Hi, my name is Dr. Jimmy Mirani, and today I'm going to be talking about cancer and breast cancer in particular. So, what is this cancer? Cancer is something which all of us have been dreading since all our childhoods, and everybody has just been saying it's the most notorious disease that anybody can ever have. Fortunately, with recent advancements in medicine and recent advancements in science and technology, we have reached a stage and a phase wherein we not only can identify this disease at an early stage, diagnose it as well as treat it as well. Now, the thing is, what is cancer? Breast cancer in particular are of two types. The number one is it's hereditary, which takes about 15 to 20% of all the breast cancers. The other is about 75 to 80%. The 15 to 20% hereditary indicates that they are transferred directly from your genes, and there's nothing much that you can possibly do about it, but diagnose it early, and at the same time be treated for it completely. Whereas the other 75 to 80% of breast cancers, which usually happen due to lifestyle modifications, can usually change these cancers, because what happens is, in a fast-paced life like Bombay, like any other metro that we live in, all of us, there is a lot of, there's an early age of menarche, there are late pregnancies, fewer pregnancies, OC pills, obesity, which is one of the major causes, smoking, and at the same time, it's ill health, junk food. All of this together culminates to something which is known as lifestyle acquired breast cancer. Now, as a woman, what is the first thing that you would notice if you were to get the beginning stages of breast cancer, which is the first thing you would notice is a painless lump. Now, the minute a woman notices a painless lump, she needs to go to the doctor, get it examined, run a battery of probably serological tests, hematological tests, and at the same time undergo some sonographies and chest x-rays, a sonomammography, all of this. Not all breast lumps are malignant, which is cancerous. Quite a few can be fibroadenomas, which can be treated conventionally as well. These fibroadenomas are not cancers, basically. And so how we go about with the treatment is we usually prefer a true cut biopsy, a core biopsy rather, and this helps us to decide the stage of the cancer, the nature of the cancer, and at the same time the hormonal positivity which is there. Now, based on this, we usually take a call whether to directly operate the patient up front, or maybe to downstage the disease with a few chemotherapies, then operate, then go ahead with chemotherapy, which is adjuvant chemotherapy and adjuvant hormonal therapy along with adjuvant radiotherapy. The thing is, the usual question that most of the women have is, do I have to take out the entire breast? Will the surgery involve complete excision of the breast? However, with again, I would say with latest advancements in medicine and latest advancements in latest technologies, breast conservation surgeries are now becoming, something which is more and more popular, and they are as good as a conventional surgery which used to be used as a complete breast removal, unless the patient has something known as multicentric breast cancer, whereas the cancer is spread all over the breast. In such a case, we might have to take off the entire breast, but we're lucky now that we've come across something known as breast reconstruction surgeries, which are gaining higher and higher popularity throughout the world these days. Now, the second thing is, what are the other symptoms? Usually it's a painless lump. However, if the woman waits too long and does not go ahead with investigations or treatment, there might be a point of time wherein she ends up, there might be some discharge from the nipple. At the same time, there might be a painful lump, which is usually in the later stage of the disease. There are two types of breast cancers. One is an early stage. The other one is a stage 4 or a metastatic stage, wherein it is completely spread. In case of an early stage, we would first prefer a core biopsy. After the biopsy, we would usually want to go ahead with a surgery if possible immediately, followed by that something which is known as sequential chemotherapy. Sequential chemotherapy usually is a sequence of an anthracycline followed by a taxane. Followed by that, we can usually go ahead with something known as a hormonal therapy based on whether she is ER, which is estrogen receptor, PR, which is progesterone receptor, and HER2 positivity, whether it's there or not there. This usually, the hormonal therapy, it's just tablets, but the treatment modality is such that it usually helps us in preventing a recurrence in hormonal related breast cancers. The other thing is, if there are any nodes which are positive, which we can find out from the histopathology report of the surgery, if there are any nodes positive, then the patient might also require some sort of adjuvant radiotherapy. The dose and everything will be decided by the radiotherapist at the end of the day. Now, most of the times the patients who come to me, and in 5 years of doing medical oncology, all the women and everybody is just more concerned. The first question, which I've already answered, is, do I have to get rid of the entire breast? Which I have answered, as I said earlier. And the second question is chemotherapy. Do I require chemotherapy? What will be the side effects of chemotherapy? Will I lose my hair? But chemotherapy as such involves very few side effects. Some of the side effects are probably hair loss, little bit of nausea, vomiting, oral mucositis, which is oral ulcerations, lack of appetite, or at the same time it can also be, probably in certain cases loss of hair. But all these side effects can be tackled. At the end of the day, all of them can be tackled medically, all of them can be treated medically, and it's just remember one thing, it is just for a particular phase of time. Just one particular phase of time, and after which you're back to normal. We might require hormonal therapy, which relatively has very low side effects, which might go on for up to 5 to 10 years post the adjuvant chemotherapy. This hormonal chemotherapy is just tablets basically, which have close to no side effects as such, but they have to be continued. Also, in cases, I urge all the ladies and all the women listening to this right now that all the people who have had a strong history of familial breast cancer should undergo regular mammograms, regular sonomammos, every yearly once, self-breast examinations regularly if possible, if the patient is alive. Now we are fortunate enough to have blood tests like BRCA1 and BRCA2. These blood tests also end up telling us things whether there is a genetic component involved or not, and we can thereby divide the two patients as a higher subgroup, wherein a patient who has higher vulnerability to this disease. All in all, at the end of the day, I would just want to conclude with one little message, which is, it's cancer, it's curable, it's breast cancer. So all in all, I would just like to say I would choose definitely 60 years of my life over the 6 months